Good afternoon, everybody. Welcome. Thank you for joining us at today's FEN workshop, Upcoming Health Changes for Immigrants, Upcoming Health Changes, Challenges, and Options. This is, it's a big conversation where I'm very excited that I get to say very little and then pass it over to an expert who will share their wisdom with us. Before we get there, just a little bit of grounding in the space. We are recording this. If you're watching on YouTube, hi, remember to like and subscribe. Oh, I can't believe I just said that. Please, if you're here live, introduce yourself in the chat, your name, organization. If you're brave and are open to connections, your email is also welcome. Please add your questions to the chat. FEN Culture our chat feature is very active. Please use emoticons, please emojis, GIFs, however you want to engage with today's workshop. Please have the chat open and ready for our conversation. We also have captions enabled. Feel free to enable those. If any of our technology in this meeting is not working, please feel free to send a direct message to myself or Jennifer. We'll be happy to do our best to make this a comfortable and accessible conversation. For folks who are new to FEN, we are a connector. We serve as the connective tissues, the weavers of big ideas around financial empowerment, financial health for Washington, where financial justice is fully practiced and communities have the power, resources, and relationships needed to build generational pathways for financial thriving. We do that in a bunch of different ways. We encourage you to check out our website, fenwa.org. But today you are here in the Financial Empowerment Network series of workshops. We are also the lead organization of Bank on Washington. We host the Financial Coaching Network as well. And our FEN Mini is a fantastic way to stay connected through your inbox. While we're hitting flow and getting everybody comfortable, I do want to make sure that our next opportunity to engage is on your radar. The Bridges Over Barriers and Economic Justice Forum is 3 weeks and 6 days away. Our 2-day annual event is, it's a lot of things, but first and foremost, it is a place to find collaborators. It is a place to find allies. It is a place to join in big conversations around the financial future of Washington, as well as ways that we can all work together to improve our community's financial health. Registration is open. We have scholarships available. We are holding space, especially for folks who are east of the mountains. Scholarship funds are one of the ways that we want to make sure that this is an accessible and open conversation. It's central to the purpose of the conversation. We also encourage you to check out our agenda and our FAQ for all of the questions and to start making a plan for your time with us. Reach out with questions. We're really excited for this conversation. Lychee, who is our presenter today, will also be presenting an unofficial follow-up to this conversation, and we're very, very excited for both. Also, while you have your calendars open, save the date, October 15th. Your clients are already asking AI about money, what financial coaches need to know, use, and protect, presented by Devin Stubblefield. Registration coming soon, and sign up for all of the newsletters from FEN to make sure that you are connected. We could not do this without the support of our current cornerstone partners. I want to take a minute and thank BECU, Wells Fargo, WaFd Bank, and Columbia Bank, both for being good partners and for helping us be here in this space, technology and all. Before we dive into this conversation, and I use conversation intentionally, we want to ground ourselves in a few community agreements. At FEN and FEN Spaces, we want to be transparent about who is in the room. So we ask that you add your name, either here in Zoom or if you've already introduced yourself in the chat. And while we're in this room, we hold everybody to a level of engagement. We ask that folks engage with respect and humanity. We ask that no hateful or hateful, discriminatory, or harmful language. In fact, we enforce that regularly. Uh, Whenever possible, speak from personal experience and use I statements, and we avoid generalizations. Uh, and a reminder that impact is not always intent, and to be aware of both when engaging in this public space. We here at FEN are committed to these community agreements and to this community of practitioners. So Ryan, I'm Ryan. Jennifer is also here from FEN. We are here if you have any requests, both comfort or otherwise. Please let us know, and we will be engaged in the comments and keeping ourselves. We hope to live up to our values. Before anything else, thank you to our presenter today, Liqi Liang with Northwest Health Law Advocates. Liqi is amazing, and I will get out of the way so that we can all learn a little bit more about the upcoming changes and challenges that our immigrant friends and neighbors will be are faced with coming soon. I'm going to stop sharing. I'm going to invite Liqi to make sure that your sharing works and to take it away.
This is always a little sketchy. I am in rural Whatcom County, so hopefully you see my awesome. Um, as soon as that happened, I got a low internet warning, so I'm going off camera while I'm sharing my slides. Um, Hello, everybody. My name is Liqi Liang, as Ryan said. Liqi is my first name. I've worked at Northwest Health Law Advocates for just over 5 years, leading our immigrant health work. So I think most of you are probably aware, lots of bad things will be happening soon. And there are things that we can do to mitigate some of those bad things. And I welcome questions. I also want to flag, I moved here from New York, so I have a tendency to talk a little quickly. Feel free to flag if you have questions, need something repeated, etc. Um, I should also say, while I've only been at NOLA for 5 years, Northwest Health Law Advocates has been working to make healthcare more accessible for over 25 years in Washington State. Um, we've done a lot of work with many organizations across the state trying to preserve our healthcare safety net and working to ensure that everyone in Washington can access quality healthcare. I should also clarify, since law is in the organizational name, I am not a lawyer. This is not legal advice. If you have questions about specific situations, you should contact a lawyer. Immigration law is incredibly complex, as is health law. So, with all the federal and state changes coming down the pike, individual situations really do need dedicated attention. Um, I think we have some polling questions set up. I hope that's true, Ryan. Yes. So I invite you to test your knowledge and am curious, do you know how many Washingtonians will lose Medicaid coverage due to HR 1? I see that I sent Ryan a typo, so it says healthcare coverage, but select away.
I'm going to leave us open for another 10 seconds. We have 70% participation. 5, 4, 3, 2.
All right. So, it is disturbing, but the third answer is actually correct. Possibly over 200,000 people in our state could lose Medicaid coverage. So, not all of those are immigrants. But Washingtonians across the state will face lots of challenges from federal changes, and unfortunately, immigrants bear the brunt of this burden. So, what is HR 1? Well, it is officially called the One Big Beautiful Bill Act. Grammar aside, it is basically the budget reconciliation bill that was signed into law last Independence Day. Um, this was the single largest cut to Medicaid programs, roughly $1 trillion in cuts nationwide. It also made significant cuts to other safety net programs like food assistance, and other things. Um, Largely in service to giving corporations and very wealthy people tax breaks. Combined with other federal administration policies across the state, 400,000 people might lose coverage. That includes people enrolling in Health Plan Finder, our state exchange, as well as people who will see or have already seen um, drops in their access to advanced premium tax credits, those federal subsidies that help people pay for health coverage. Significant costs are being shifted to the state. So we are in our state doing our best to mitigate some of those harms, but it's going to be a rough go. So, state challenges due to those shifts include a $1 billion shortfall in the next budget cycle. The bottom line is the upcoming legislative session that starts in January will be largely a conversation about cuts. We have seen the impact of tariffs, of changing tariffs. We've seen the impact of provider taxes changing, and we've seen the effects of inflation, quite frankly. Um, while this past session, our legislature did try to improve the regressive nature of Washington's tax structure, the millionaire's tax won't be available until 2029 at the earliest. So, big hole in the budget, and we are the second most regressive state in the nation in terms of tax structure. So, we're in kind of a tough place. There should be additional revenue forecasts next month and again in November. Hopefully, we'll hear better news. But right now, the directive from the Office of Financial Management is agencies have been instructed to really tighten their belts. Only mandatory increases like union contracts, cost of living adjustments, but largely focus on cuts. So, how many Washingtonians will suffer? Well, some of these cuts have already started. So, the Health Benefit Exchange announced that over 36,000 people dropped qualified health plan coverage during this past open enrollment. So, and we've actually heard that that number might be even higher because that was the number from May. Um, that happened in January when those enhanced federal subsidies went away. Additionally, all lawfully present immigrants living in poverty lost access to all federal subsidies to help with purchasing health coverage. Over 10,000 of our neighbors, community members, family members lost access to affordable health plans at that point. In less than 2 months, the Healthcare Authority expects about 15,000 lawfully present immigrants to lose Medicaid. That includes refugees, asylees, victims of trafficking, basically any lawfully present individual who is not a naturalized citizen, a green card holder, a COFA migrant, or a Cuban or Haitian entrant will lose access to Medicaid in less than 2 months. Of these people, about 10% are currently utilizing life-sustaining long-term services and supports. These are really medically frail people. These are elders and people living with disabilities. So life's going to get a lot harder for thousands of people. In January, an unknown number of lawfully present immigrants will lose access to Medicare. Again, anyone who's not a naturalized citizen, green card holder, COFA migrant, or Cuban or Haitian entrant. We've asked agencies and federal advocates what the number in our state is and have not received a response. But some number of elders will lose Medicare. Also in January, about 10 to 15,000 lawfully present immigrants whose income is over 100% of the federal poverty level will lose access to federal premium assistance. Um, they'll lose access to affordable health coverage, basically. Um, Also in January, Medicaid expansion, which encompasses adults, um, 19 and older, who uh, until this point have not had a work reporting requirement, will have to report if they are working in school or otherwise engaged with the community. There are other eligibility and enrollment changes. Redeterminations will double. It'll go from once every year to once every 6 months, and there will be reductions in retroactive coverage. Um, that's going to have an impact on between 200,000 and 250,000 people in terms of needing to meet those requirements, those paperwork requirements, and potentially losing Medicaid if they don't meet those requirements. Um, Additionally, in October of 2028, cost sharing requirements will come into play. So a lot of changes will soon happen, and the most acute ones, the ones that come soonest, will be happening to immigrants in the next few months. So, which immigrants face losing Medicaid in less than 2 months? I think Ryan has queued up another poll for us.
Yes, and launch. There we go. Oh, slight difference in question asking.
Oh, sorry. Yes. Which immigrants will
Apologies.
still have Medicaid in October?
Give us another 10 seconds.
I will
5,
move the confusing
4,
question from the
3.
screen.
There we go. Share results.
Yes. People have been paying attention. Thank you. Um, Only people who are naturalized, have a green card, COFA migrants, and Cuban and Haitian immigrants will have access to Medicaid. Refugees, victims of trafficking, Afghan and Ukrainian parolees will all lose access to Medicaid in less than 2 months. I want to take a step back and talk about who the immigrants are in Washington State and how they contribute to our communities. So, more than one of every 7 people in Washington were born abroad. Um, Almost a quarter of Washington immigrants lack federal immigration status. But over 90% are of working age. Overall, immigrants paid $6.5 billion in state and local taxes. And of that number, undocumented Washingtonians paid over $1 billion in state and local taxes. Immigrants make our economy stronger. They make our communities stronger. They make many of our families stronger. And in terms of families, over 200,000 US citizens live in a mixed status family, and that includes over 144,000 US citizen children. Immigrants are part of who we are in Washington, as well as the nation. And so when we're talking about immigrant health, that has implications for everyone. So, who's excluded in Washington from the healthcare safety net today? Well, due to the racist nature of immigration policy in the US, the majority of people who are undocumented immigrants are people of color. In Washington state, the vast majority of people who are undocumented are people of color. Um, as you can see, according to OFM, 43% come from Asia or the Pacific Islands. Another 39% identify as Hispanic or Latin. Um, Only 14% are non-Hispanic white. That's not an accident. I think most people with any familiarity with immigration law understands that there has been a long history of exclusion, and that exclusion is largely based or intended to exclude people outside of Europe. So, the good news is that Washington has actually done a lot to try to strengthen the healthcare safety net for all of us. Um, Apple Health for Kids is available regardless of immigration status, as is pregnancy-related coverage, which includes 1 year of postpartum coverage, no matter how a pregnancy ends. Hospital charity care is actually available to roughly half the people in our state. If you find yourself going to the ER, please make sure to fill out that financial assistance form. It can help with copays and deductibles, so it doesn't hurt to fill it out. There's also the emergency medical program, which is for people who aren't eligible for Medicaid or Apple Health. It is limited to people with specific health conditions, and people who go to the ER, and is limited to people with income up to 138% of the federal poverty level. Um, in November of 2023, all Washingtonians were able to shop on our state exchange for qualified health plans. People do need to now connect with a navigator to purchase those health plans if they are undocumented, but everyone in Washington, regardless of immigration status, up to 250% of the federal poverty level, can get Cascade Care Savings assistance. That's up to $250 a month to help pay for monthly premiums on our state exchange. In July of 2024, the Apple Health expansion, a Medicaid-like program for people without access to Medicaid or advanced premium tax credits, was launched. That program filled in less than 2 days, basically. There's a lot of interest, and actually, almost 34,000 people are on the wait list today. So still a lot of interest. This session, despite a challenging budget environment, we were glad to see that both Apple Health expansion and Cascade Care Savings were funded. Looking ahead, as I mentioned, things look a little less safe. The Apple Health expansion program will move from its current managed care structure to a fee-for-service structure, but that also means that 5,000 spaces will open. Everything is, of course, contingent on the status of our budget, and there will be lots of conversations about cuts starting in January. So, I want to just ground us, and as a visual learner, I find timelines helpful in what has happened and what will happen. So this January, all lawfully present immigrants living in poverty lost access to federal assistance to pay for qualified health plans. Again, the good news is all Washingtonians up to 250% of the federal poverty level can still access Cascade Care Savings. However, those state subsidies are not nearly as large as advanced premium tax credits. So health plans likely got a lot more expensive. This October, in less than 2 months, on the 1st of October, federal Medicaid and CHIP ends for many lawfully present immigrants, including asylees and refugees. It ends for anyone who's not naturalized, a green card holder, a COFA migrant, or a Cuban or Haitian entrant. Now, Washington will still continue Apple Health for Kids and pregnancy-related coverage, regardless of immigration status, but obviously there are many people outside of those categories. Now, a little purple funny shape is a reminder that during the months of October through December, people who are losing Medicaid can still access Cascade Care Savings, and a subset whose income is over 100% of the federal poverty level can access advanced premium tax credits. Unfortunately, in January, that also gets taken away from those same groups. And in addition to that, Medicare ends for most lawfully present immigrants, including asylees and refugees. Basically, anyone who's not naturalized, a green card holder, COFA migrant, or Cuban or Haitian entrant. So that's the next couple of months. Now, I want to call your attention to our elders and people living with disabilities. As I mentioned, about 1,500 people across the state currently are on Medicaid, expected to lose Medicaid, but today are losing long-term services and supports. Before the legislative session started, the estimate was that was about 2,700 people. So the good news is that over 1,000 people did actually have a green card or naturalized and won't lose Medicaid. Unfortunately, there are still 1,500 people across the state who are dependent on life-sustaining care through Medicaid, and most of them are elders. Most of them are living with their family members. Most of them have a chronic illness. This is a really medically fragile population. And quite frankly, people are going to die. So, as a reminder, September 30th is the last day of Apple Health Medicaid coverage for lawfully present immigrants who will lose coverage. Anyone who gets a letter saying they're going to lose coverage should see the doctor, refill prescriptions, try to get a 3-month refill of prescriptions, take care of what they can in terms of Medicaid before September 30th. Between October and December of this year, there are federal premium subsidies available for people at 100 to 138% of the federal poverty level, and Apple Health for Kids and pregnancy related coverage does remain available, as does AEM, the Emergency Medical Program, and refugee assistance, should that be relevant. So, options for people who become ineligible for Medicaid due to HR 1, you're encouraged to go to Washington Health Plan Finder to see whether you're available for federal premium assistance. Everyone should be able to access Cascade Care Savings. That does include premiums of up to or subsidies of up to $250 a month in premium assistance this year. Lawfully present immigrants can just go through Health Plan Finder. Everyone losing Medicaid should be lawfully present, but just a reminder that immigrants without federal status can't actually purchase plans on Health Plan Finder. They should go through the Washington Pathways route. Now, you may have remembered on that first timeline, I mentioned Apple Health expansion, and that is a program for people who don't have access to either Medicaid or advanced premium tax credits. So, some of those folks who losing Medicaid will become eligible for Apple Health expansion. The way the Healthcare Authority has structured things is people will be considered when space becomes available, and we know that the legislature allocated funds to open up 5,000 spaces in January. So going through Health Plan Finder for people 19 to 64 basically puts them on the list to be considered. For immigrants 65 and older, you actually have to go through Washington Connections and DSHS in order to be considered for Apple Health expansion. Um, I know there's a lot of information. I know it's very confusing. To try to help, we put together this free and reduced price health options in Washington State one pager. It is currently available in English, Spanish, Chinese, simplified Chinese, and Vietnamese. Um, it just lists the safety net programs that everyone has access to. I can put links in chat once I stop sharing screen. We also have a survey currently open. Anyone who is enrolled in Apple Health expansion or eligible for Apple Health expansion, we would love to get your opinion. And we would love to learn what you would prioritize as we approach very difficult conversations during the legislative session. So I can also drop that link in chat when I'm done sharing screen. So I do want to make a note about advanced premium tax credits, the federal subsidies versus Cascade Care Savings. This illustrates the different experiences for a lawfully present immigrant living in poverty versus one who's just over the federal poverty level. So in this slide provided by the Health Benefit Exchange, you can see Maria on top is earning 115% of the federal poverty level, or about $18,000. So she can go shopping on Health Plan Finder and find a plan with a $0 monthly premium. So she won't have to pay anything monthly to continue coverage. If she sees the doctor, she might have copays. By contrast, Carlos is just under the federal poverty level. He makes $12,000 a year. So he actually only qualifies for Cascade Care Savings, which means he's looking at a monthly premium of over $200 a month. Little hard to swing when you're living on $1,000 a month. So not what I would personally consider affordable health coverage. This is one of the cruel aspects of HR 1, the fact that in January, federal subsidies were taken away from all lawfully present immigrants living in poverty, really means that things are more expensive when you're poor. So, I like timelines. You probably gathered that. These are the important dates to keep in mind. By next week, by August 10th, if you are a lawfully present immigrant or if you work with lawfully present immigrants, please update your information with the healthcare authority. Make sure they have your correct address. If your immigration status has changed, make sure you let them know that. In early September, people who HCA plans on terminating from Medicaid should get a letter. So keep your eye on the mail. And by the end of next month, see your doctor. Get your prescriptions filled. Take care of what you can while you still have Apple Health coverage. If you would like to get coverage on Health Plan Finder, make sure you shop by October 9th. That is the date that you need to engage to have continuous coverage, to be covered for October and hopefully November and December. In November, open enrollment opens again, and you will be able to see what you qualify for moving forward for 2027. So, as a reminder, non-citizens who keep Medicaid are naturalized citizens, naturalized citizens aren't non-citizens. Sorry. Non-citizens who keep Medicaid are lawful permanent residents. That means anyone with a green card. Remember that the 5-year bar still applies, but there are many exemptions. COFA migrants, Cuban Haitian entrants, and lawfully present immigrants not in the categories above will lose Medicaid. So I'm going to pivot to some questions that may arise for everyone. But
Lychee,
all, yes.
before you transition, this is a natural stopping point. There was a question in the chat. What is a COFA migrant, please?
Oh, so COFA migrants are oh, can I remember the acronym? I am so sorry. It's basically Micronesians, people from the Pacific Islands, people from countries that we tested atomic weapons on, are exempt from the HR1 Medicaid cuts.
Thank you. I don't think that that was an acronym that I was familiar with. And thanks for letting me interrupt.
Yes, thanks for asking. Sorry about the alphabet soup. Um, Lots of people are really concerned about their privacy these days. Lots of immigrants, especially. Um, so you might recall that last spring, the Associated Press reported that the federal Medicaid agency had shared data with the Department of Homeland Security, which oversees Immigration and Customs Enforcement, ICE. Um, Washington's Attorney General's office and other states sued because they shouldn't have done that. They don't have the right to share that information willy-nilly. This January, the judge that is hearing that suit, allowed for limited data sharing in the states that sued. However, he clarified in April that due to some confusion around definitions and practice, today Medicaid data can't be shared with the Department of Homeland Security, and that the Department of Homeland Security cannot use any data it already has for immigration enforcement. However, next week, actually a week from today, on the 13th, there is another hearing. So this is current information as of today. It may change next week, but today, Medicaid data can't be shared with ICE. We will post updates as we learn about them. This is an ongoing lawsuit, so things change. And I wish there were more clear lines and easy answers, but I think this is what we know today. So, some upcoming changes for the people who retain access to Medicaid. Um, as a reminder, in January, those new work reporting requirements come into play. These are sometimes called work requirements or community engagement requirements. Basically, you need to demonstrate or attest that you are meeting these requirements. Early indications from HCA is they will allow self-attestation for the year of 2027. Also, there will be more frequent check-ins with the healthcare authority. Those will happen every 6 months instead of every 12 months, so they will double. And looking ahead in October, cost sharing of some type will be required. States aren't allowed to skip the requirement for cost sharing. But there are still exemptions for primary care, behavioral health, services at federally qualified health centers, rural health centers, and community behavioral health clinics. So changes will be afoot. The healthcare authority is still sorting through what the implementation for those changes will look like, but you should at least prepare to self-attest to working. Even if you get to keep your Medicaid. So, what is public charge and how will it change? I think Ryan has another poll for us.
The follow-up question of how will it change would be a great prompt for the chat. I like this a lot. I will give us another 10 seconds. 5, 4, 3, 2,
Great. You guys are 61% of you are spot on. Um, yes. So, public charge, is what we call the test when an immigrant applies for permanent residency, what most people call a green card. So, it also applies when someone leaves the country as a green card holder for more than 6 months. Government officials basically ask the question, are you likely to become dependent on the government for support? This test does not apply to all immigrants. New public charge rules were just released, and we'll talk about those changes that are expected to go into effect September 18th. Again, this is what we know today. We expect more guidance from the federal government, so changes are afoot. So what won't change? Let's start with what's staying the same. The people to whom public charge applies remains the same. If an individual is applying for a family-based green card, if they're applying for an employment-based green card, if they're applying for a green card as a religious emissary, and some other special categories, that's a very long list. But largely, like 60% of the people to whom public charge applies are family-based applicants. It's important to note that people who apply in a humanitarian status, such as a refugee or asylee, as a survivor of trafficking or a survivor of a crime, a military green card, those groups are exempt. And this policy will not change in September. This is staying the same. Historically, the public charge test has looked at a broad array of holistic circumstances. As you can see, people's skills, people's age, people's education, people's health, people's work history, people's income, and an affidavit of support all come into play, in addition to very specific benefits. Those benefits for the last 4 decades have been cash assistance and long-term institutionalization paid for by the government. Only those two for the past 40 years. The affidavit of support, basically a statement of support, was also a significant factor in the public charge test for the last 4 decades. The implementation timeline is today, the Biden rule is still in effect. There was a final rule that was published with a 60-day implementation period. The end of the 60 days is September 18th, so that is when the new rule will start. Should also flag that demonstrations of harm can support legal challenges to stop implementation. So I know national advocates are looking to file suit of imminent harm as a result of this new public charge rule. And you can help potentially. So as a reminder, if you are thinking of planning on filing for adjustment of status to become a green card holder, you should talk to a lawyer, and you should talk to a lawyer as soon as possible, ideally to file before September 18th when these rules come into play. And if you can't file before September 18th, we would appreciate your assistance documenting potential harms of this new rule. More on that in a few slides. So, what changes? Well, what's considered a public charge will change. As I mentioned today, it's limited to cash assistance and long-term institutionalization at the government expense. Starting September 18th, immigration officials won't be restricted. They can look at lots of benefits, state benefits, federal benefits, tribal benefits, and not just limited to cash assistance or long-term institutionalization. Will previous use of safety net programs count? Today, only for those two benefits. Starting on September 18th, the new policy allows consideration of those two benefits before September 18th and the use of any other safety net benefits September 18th moving forward. Will a family member's use of benefits be considered? Today, the answer is a very clear no. Moving forward, the answer is yes. The new policy allows the use of benefits by dependents to be considered in a public charge determination. That is a huge change that has chilling implications for mixed status families. So, a couple more questions. Is an affidavit of support a consideration? Today, yes, it is required for anyone who's sponsored. Applicants with a sponsor are likely to pass the public charge test, or more likely to pass when they have those affidavits of support. After September 18th, it is required, but immigration officers aren't required to treat it as an asset. What other factors could be considered? Well, as that honeycomb setup on the prior slide demonstrated, there's a whole host of things that immigration officers are supposed to look at. Age, income, education, skills, employment, health, affidavit of support, and the use of certain two benefit programs. Moving forward, all those things can be considered, as well as any means-tested benefit program and whatever the immigration officer feels like. And yes, that is as big and amorphous a category as it sounds. So, really confusing, intentionally chaotic. So, what do you tell the people in your community? Well, most people don't have to worry about public charge at all. Remember, it only applies to some green card applicants. If you already have a green card and you're not planning on leaving, it doesn't apply to you. If you don't have a way to get a green card, it doesn't apply to you. The current rule is in place until September 18th. The new rule says more guidance will be issued. We are keeping an eye out for that guidance and we'll share information as soon as we have it. As a reminder, the public charge isn't just about benefits use. Federal law does say that officials must consider affidavits of support, work history, health, income, resources. These rules are very complicated, like all immigration law. So please talk to a lawyer before you leave the country or apply for a green card. Advocates are hard at work trying to fight this rule, so please keep an eye on updates. And please stay connected to local community-based organizations so we can get out accurate information. Everyone needs to do what's best for themselves and their family. So weighing these hard decisions is really something that each individual and family needs to decide for themselves. There are a wealth of immigration resources available. You can get immigration advice and legal advice. I will drop that link in chat when I stop sharing the screen. But off the top of my head, the CLEAR Hotline and Northwest Immigrant Rights Project are both great sources for more information. So, I know I've thrown a lot at you. I know it's really confusing. So, the question that comes up most often is, does public charge apply to me? And that's a question that we have partnered with One America and Protecting Immigrant Families Nationwide to try to answer in a succinct way. We have produced the document screenshotted in English, Spanish, Simplified Chinese, and Vietnamese. So I will also drop those links in chat when I'm done sharing screen. So how do we make things better? I think this is really the question of the day. Um, Please tell your community. Many people don't know these changes are happening, and we don't want them caught off guard. People need to make plans to prepare if they're losing Medicaid or if they're thinking about applying for a green card. Make sure you share resources. Share your experience if that's something you feel comfortable doing. You can share your experience as a provider. You can share your experience as a community member. We are collecting stories through a health affordability effort nationwide called Overcharged. You can see the URL on the screen. I will also drop that link in chat. We're still a democracy. So if healthcare and immigrant health are important to you, please tell your elected officials what you care about, what your priorities are. And please support organizations doing the work of trying to improve immigrant health. Um, Lots of things are happening and it's very complicated. So one of the things Northwest Health Law Advocates does is we send a lot of letters to agencies, elected officials, um, government agencies, federal and state, advocating for what we think they should do. I work with a number of really smart lawyers and lots of great CBOs across the state, and we're stronger together. So we do a lot of sign-on letters, and I think Ryan can share some of those with you if you are interested. Um, Looking ahead to the next few months, there, as I mentioned, are very bad things happening. So Washington's going to be grappling with some really hard decisions. Basically, how are we going to use limited state dollars to support people newly losing coverage or challenged in a variety of ways? So, the first, most immediate and acute need is the question of state allocated long-term care slots. So, um, those of you who are sort of wonkier may recall that this spring, the legislature actually invested state funding and allocated an amount to say, we want to expand the number of state long-term care spaces available so people don't end up in the emergency room and or die. They thought they had enough money to cover 1,191 people. Our legislative session is early. It ends in March. In April, the federal government issued new guidance that said you can't kick people off when they'd normally be kicked off on that yearly cycle. Everyone gets kicked off on October 1st, which meant that 1,191 spots turned into less than 200 spots for 1,500 people. So DSHS, the agency that oversees long-term services and supports, is responsible for deciding how to allocate those spots, and they're also responsible for telling the governor and the legislature how to cut benefits and services, which is a terrible question to try to answer. Cascade Care Savings, the state subsidy for qualified health plans on our state exchange, is renewed every year. The legislature decides how much money to put into that program every year. This year, they put in enough money for everyone to get up to $250 every month if they are up to 250% of the federal poverty level. But this is significantly less than federal subsidies. Um, Also, you may have noticed healthcare costs are going up. Um, Insurance prices are going up, I think an average of 22%, which is obscene and well beyond inflation. But that means that those premium subsidies aren't going as far. And Apple Health expansion. The legislature said 5,000 new spots will open in January. I may have mentioned that today almost 34,000 people are waiting for those spots, and another 15,000 people will join them in January. Um, the Healthcare Authority also has a report on cutting benefits and services that's due to the governor and the legislature on October 1st. So, lots of really hard decisions, lots of really gross conversations, and lots of opportunities for you to potentially weigh in. We basically need everyone to help figure out how to move forward. With the $1 billion shortfall, we know this conversation next legislative session is going to be about cuts. The governor will likely propose cuts when he releases his budget in December. State-funded immigrant programs aren't protected in the law in the same way many other programs are. So they're more vulnerable to cuts. Governor Ferguson actually proposed that 8% of all of his cuts this last budget cycle come from the Apple Health Expansion Program exclusively, this tiny program that serves less than 10,000 people. So we're anticipating a lot of defensive work. Until the millionaire's tax comes into play, we are the second most regressive state in the country when it comes to tax structure. That means poor people pay a much larger percentage of their income in taxes than rich people. And that's just wrong because they have so much less income. So thank you for letting me share some information. I'm sorry it wasn't happier. And I will stop sharing screen so I can share some resources and see if there are any questions I can help with.
Thank you, Lishi. Although it was not a happy subject, I feel some level of obligation to sit with this information, and it's not a good feeling, but it is a comfort to be here in this room amongst people who I know also are experiencing the same emotions that I am. That is a small comfort at the very least. Jennifer and I did our best to try and preempt the links that you're going to drop. So feel free to re-drop them and find the ones that we might have missed. While you are doing that, I did catch a few questions that have come in thus far, and I would encourage folks who were listening intently and working on their questions in the background of their brain to please add them in the chat while we move forward. We had a question on the temporary data sharing agreement that was struck down. Do you know what has already been shared, or if there are any consumer protection pieces that can be moved forward in that space?
The Healthcare Authority hasn't been very transparent. We know that personally identifying information has been collected. Just when you apply for Medicaid, they ask for things like your name and your address and your phone number. And until last year, people shared that information knowing that it would stay at the federal Medicaid agency. That changed, and was a disturbing surprise, I think, to everyone who works in social services. We don't know what was shared. And we don't know a lot of questions or answers to questions, unfortunately. And given the way the federal administration operates, I don't think consumer protections are really where they're at. This is information about people who utilize the benefit that's partially funded by federal dollars. So the federal government has the right to gather some information for the purposes of determining whether or not benefits like Medicaid were administered fairly. They don't have the right to use that information for immigration enforcement. Or at least that's the position of our attorney general and 21 other attorney generals. And that is the active litigation that's going on as we speak. So, sorry, it's not a better answer.
But it is an answer, and that is one of those pieces that we are in an era, or we are in a time where we appreciate people who are closer to the work and closer to the questions, and can get us closer to supporting our people as best we can. Another question in the chat that might have all been answered, but wanted to give space for it. If a client is a permanent resident, has a green card, is it convenient to apply for cash assistance? Marcia, feel free to come off mute and expand if you had other thoughts.
Hi, thank you. So yes, I'm wondering, but I think Lee mentioned after I asked the question, because I have a couple clients. They have, like the green card, but they still waiting, to meet the 5 years bar.
Okay.
But I have a case, because her age, I'm trying to find some cash assistance for her, and that's the case. I don't want to push to get a resource that affect her, in the future if she wants to become a citizen. Because now we don't know how the laws works. There is a lot of changes, so I don't want to put in risk my clients. So basically, that was my question.
And again,
thank you.
Yeah, no, thanks for asking. And unfortunately, I am not a lawyer. So, my understanding is the public charge rule only comes into play when you're applying for a green card. So, these questions don't come into play if you have a green card. But if she plans on leaving the country for 6 months or more, they could come into play again. So it would really depend on her individual circumstances. And if she's thinking of leaving the country, she should talk to an immigration lawyer.
Thank you.
But anyone with a green card who's not planning on leaving should be okay.
As clear a crystal ball as we can provide.
Should be okay based on what we know today, which I think we all know is sort of a moving target, unfortunately.
Yeah, very true. We have time and space. Any other questions, comments, concerns in the chat? I'll also invite folks, knowing that we are not immigration attorneys, nor are we health attorneys or doctors. I welcome if folks want to share any of the challenges that they are working on in the chat, questions that have come up from clients. I've often found that knowing that you're not the only one with a question is, if it's not an answer, it's at least a movement in the right direction. So for the next couple of minutes, I would invite folks to put in the chat your questions or your experiences in this area. No worries, Lychee. So that we can all be in community together as we move forward. I'm also seeing in the chat. Thank you, Lychee, for dropping links. Jennifer, go for it.
I'm just full of questions. So regarding the public charge, what I think I heard you say, and I just want to clarify, is that for those for whom public charge impacts them, it used to be just those two programs, but now officials can consider state safety net resources that were literally designed for people that don't qualify for federal resources, and they can look at those when they're determining public charge. Is that correct?
So starting September 18th, the new federal rule, which is very broadly written and confusingly written, does seem to indicate an intention to consider any means-tested benefit, including state benefits.
So as a state, we have designed programs and benefits to support immigrants and refugees that now can be used against them. In
Could
the
potentially
yeah,
be
yeah,
used in a public charge determination.
right.
Um, and it is a lot is intended to be left at the discretion of immigration officials, which is one of the key complications of this. But yes, the federal administration has issued a final rule that basically says, I'm not a lawyer, but my understanding is immigration officials can consider whatever they want. And I will say that nationwide advocates are trying to document harms and trying to hoping to file suit to prevent implementation, or once harms are demonstrated, to get an injunction, or get to stop the rule from continuing, determining depending on the timing of the lawsuit. Does that answer make sense?
As much as the law does.
That is the question, yes.
Oh dear. Oh dear. A question came into the chat from Catherine. I'll read I'll paraphrase, but Catherine, feel free to come off mute and add any context. Recently approved for SSI, but has not yet received their green card. An application is open, but there's a processing freeze. Wondering whether pending green card applications that were submitted before the freeze will continue to be processed.
Great question. Question that has come up a lot because many of the people losing long-term care actually have pending green card applications. So what I know as a non-lawyer is that the Dorcas case, which is the Rhode Island case around the freeze, the USCIS freeze of processing, currently, my understanding is USCIS has been instructed to continue processing green cards. There should not be a freeze on processing today, is my understanding. I will also concede that I have not checked that case in about a week, but I did have a conversation about it just last week. If you have a client who has a green card application in, you're probably aware that processing times vary greatly. I think when I looked, it was like an employment-based green card usually went through in about 9 months. By contrast, a refugee green card application took north of 3 years. Um, Given the imminent harm of losing healthcare coverage, I would encourage you to consider helping your client reach out to their congressional representative to expedite their green card application. Depending on who your representative is, it might be a very easy web form, or it might be a very confusing call to their office. Um, Reps vary in their constituent services. I will say Patty Murray also helps with these requests. She's our senator, and her website is fairly straightforward, more straightforward than Maria Cantwell's, in my personal opinion. But again, depending on who your rep is, or their rep is, their congressional representative, this is actually one of the things they're responsible for, constituent services. So they can ask to have their green card expedited due to imminent harm. Did that answer make sense?
I think so. I'm working on copying and pasting in how to find your congressional representative.
Awesome. Thanks, Ryan.
I know that there is a way to do it through the Washington legislative finder. Why does the U.S. representative site be painful? Okay. Wonderful. Catherine, that was your question, and so any other context or the question of whether or not it was answered is yours, in fact. Oh, I'm now looking at my. Oh, there we go. Yeah, go ahead. Okay. Then I will do another call for questions, comments, concerns, and knowing that there will be a follow-up email with all of the resources that were shared in the chat, and hopefully that will go out soon. Alrighty then. With the greatest gratitude to Lychee and the Northwest Health Law Advocates for gathering all of this information in a way that makes a big, scary topic at least understandable, if not less scary. I think Lychee's email and contact information was in the slides that were provided in the link, but please feel free to reach out to myself or Jennifer for connections with any of the resources that have been mentioned today. Thank you, Lychee, for putting your email in the chat. Jennifer also just put in our workshop evaluation. Please take a minute to share your thoughts. We use this information to build all of these workshops, as well as making decisions about what material or what content is of interest to our groups. I cannot put into words how big of a task is in front of us, and thank you for joining us for this important conversation. Thank you for stepping into big feelings, and thank you for trusting us with this conversation. Jennifer also just dropped into resources. We recognize that fires are going on in much of Washington. So our friends at the Washington Homeownership Resource Center have natural disaster resources ready to go for folks who lost their homes in the fire. Stay connected with us, join our newsletters, stay connected with Lychee, make our voices heard. With all of the love and gratitude that I can share, go forth and do great things, everybody.